It's Wendy Bowen with Know Your Body Better.
So we're going to look at next I've got 6 layers of the muscles. So in the first picture, you're going to see the really fine muscles deep in the spine. These ones are for control. They help steer the joints, keep them stable. The second layer, you see just a little bit more, but you can see a lot of the bones. As we build up to the third layer, the muscles get a little bit thicker. And then you've got the fourth layer, again, even thicker. The fifth, sixth layer, what you're going to start to see are the serratus posterior muscles and the rhomboids come in. Those are the ones between the shoulder blades. You'll also see the levator scapulae, and I'll put that in there. That's a very important muscle for the neck because it comes off the top of the shoulder blade. It is a levator, so it's like an elevator. It lifts the scapula, which is your shoulder blade. And so what happens, that muscle tends to be tight more often than it's not. Some muscles in the body respond to stress by shutting down, other ones respond by tightening up. And this one seems to be one that tightens up. So that's where you end up walking around like this. Your shoulder blade seems lifted. And if you're not going to walk around like that, then what happens is the levator scapulae will pull your neck this way. And we'll show you how to stretch that. And then there's a picture here of the trapezius muscle, and you can see how large it actually is, coming off the base of the neck down to the tops of the shoulders and way down to your back down here. So that's a really, really big muscle. And then we have the upper trapezius, the middle ones, and the lower ones, and we strengthen those in different ways. So I'll show you how to do that in a bit because it's really important. Usually the top ones get tight, the middle ones and the lower ones are weak. So we have to usually strengthen the middle and the lower, not the upper ones. And there's a difference in how to strengthen those two muscles, or those 3 muscles that we want to look at. The last really important group of muscles are the scalene muscles. And they're down the side here, and there's a group of 3, and they attach to the first and second ribs. And what happens when those get tight, quite often when a whiplash injury, is they will compress the neck down here into this side flexion bent position, which is ending up pinching all the nerves. And a lot of people get a lot of pain referred down their arm when these muscles get tight and stiff. And so we'll look at how are we going to stretch those out and take the pressure off the nerve.
It's Wendy Bowen with Know Your Body Better.